knowledge, power and infrastructure to improvise something big for these needy mothers and small babies, I'm sure we will succeed. I've just put on 3 case scenarios to take you through. A 32-year-old woman consults you for preconceptional advice. She has past history of 2 pregnancy losses at 14 weeks and 16 weeks over the last 3 years. Early pregnancy evaluation had shown a normal fetus in both pregnancies. She's in good health otherwise. Her main concerns are pregnancy loss and preterm labor. Is this woman at risk for preterm labor? And if at all she is in the risk of preterm labor, can it be predicted? And what are the factors that you would make her to think in terms of a high suspicion of cervical insufficiency as a possible cause for her losses is the concern with which she'll come to you with. Get the point clear that a kilobyte of prevention or a gigabyte of repair, I'm sure a kilobyte of prevention is better. So how could you predict preterm labor in this woman? We have a small tool but a very effective tool called as fetal fibronectin. And fetal fibronectin has been advocated as a promising predictive test, but it may have limited accuracy in predicting preterm labor within 7 days. What I wanted to tell you is that if preterm labor has been predicted with fetal fibronectin, it's valid only for 1 week. That means we need to do another fetal fibronectin after another week to say that she may not go into preterm labor for the next 1 week. That's the first disadvantage of fetal fibronectin. Second disadvantage is that it is not available for clinical use in the pharmacy, in the labs and hospitals. It has still not come to the prescription of the clinician's desk so that you can ask a patient to go and get fetal fibronectin. Very common. Second. Third, it is a little bit expensive to use, and so fetal fibronectin at the moment has limited role but still has got a positive role, but to use them to predict preterm labor is a question mark which you need to take it with a pinch of salt. Could you do assessment of the cervical length? This has been done for quite some time and very successful. Ultrasound of cervical length needs a little bit of difficulty because you need a good sonologist to do a assessment of the cervical length. Ultrasound assessment of cervical length is a promising predictive test for symptomatic women. It remains unclear whether any predictive test or a combination of tests is sufficiently accurate to be cost effective, was the conclusion of the Apostle trial which came 10 years back. But then we had kept a cutoff of 2.5 centimeters as length of the cervix, and would you offer them cerclage is the question.